Hi, I'm Dr. Fruth, family physician, and this is today's consultation. I've had to tell a lot of patients through the years that they have a sexually transmitted infection, and it seems that one of the most distressing STDs is herpes. I can remember back in the 80s when Time magazine carried a cover story about the scourge of herpes, and support groups popped up all over the country. Then came HIV. And the true impact of a herpes infection came into perspective, because while annoying, herpes is rarely life-threatening. Herpes simplex virus comes in two varieties, HSV1 and HSV2. HSV1 tends to infect the areas around the mouth or lips, while HSV2 infects the areas around the penis in males and the vagina in women. However, now, primary genital herpes with HSV1 is as common or more common than primary genital herpes with HSV2. I'll let you figure out why. Genital herpes is more common than you may think. 20% of Americans have been infected with the virus, with 1 million new cases every year. Well, how does someone get herpes? You get infected with the virus when your skin comes in contact with the skin or the secretions of someone who is shedding the virus. The scary thing is that someone may be shedding the virus and you may not even know it. The virus may be present on the skin of the individual or in their secretions, and they may not know it as well. Well, here's what happens if you get in contact with the virus. You may feel a localized tingling, burning, or pain where the virus comes in contact with your skin. Then there might be symptoms of viral illness such as aching and fever. Eventually there's usually an eruption of vesicles or blisters that then break down into ulcers. The initial outbreak lasts for about 2 weeks, and during that time the virus travels up the nerve to its final home, which is the spinal cord. There you trust your immune system to keep it there. However, during periods of stress, emotional stress, environmental stress, even getting very cold, your immune system may get distracted. And during that time, the virus might travel back down that nerve and then cause a new outbreak. These new outbreaks tend to occur near the vagina or the penis, or in the area of the buttocks or upper thigh. Often patients are unaware of recurrence, about 50 to 90% of the time, with recurrence of HSV1 occurring about once a year, and HSV2 occurring 4 to 5 times a year. Fortunately, both types of the viruses tend to burn out as the years go on. When is a herpes outbreak dangerous? Persons with an HSV2 infection in the genital area are 3 times more likely to acquire HIV if they come in contact with that virus, due to the open sores that allow the HIV virus to enter. Another serious complication is transmission of the virus to an infant during delivery. This is actually pretty rare, considering that 20% of all pregnant women have antibodies to HSV2 and about 60% to HSV1. Prevention with an antiviral medicine like acyclovir is recommended during the last month of pregnancy for women who have genital herpes to prevent transmission to the baby during delivery. Neonatal herpes infection is very serious. There is antiviral medicine that your family physician can prescribe to prevent recurrences or to be used episodically for occasional outbreaks. In that case, it's really good to know what those early symptoms of an outbreak are so you can start taking the medicine as soon as possible. Unfortunately, herpes is the gift that keeps on giving. Once you have the virus, it never goes away. But good nutrition, rest, stress reduction can help reduce recurrences. If you know you have herpes, do the right thing. Inform and protect your partner by using condoms or by be sure that your partner uses condoms. This helps to reduce but does not eliminate the risk of infection. And be smart. Know what safe sex practices are. to reduce your risk of getting any sexually transmitted infection. This is Dr. Fruth, family physician, and this is today's consultation. Please like, subscribe, and follow, but remember, these videos are for educational purposes only, so contact your personal health care provider for your own personal health care needs.